Hello everyone, this video is about empowering patients, and what better way to do that than encouraging patients to make informed decisions. Patients that are well informed tend to make better decisions and be less anxious about their condition and their outcomes. My name is Christian Borberg. I'm an obstetrician and gynecologist. I've been practicing obstetrics and gynecology since 2012 as an attending physician, and I'm a board certified by the American Board of Obstetrics and Gynecology. And this pertains mostly to informed consent, which is a very broad topic, but I'm going to talk about it from an obstetrician and gynecologist perspective, using most of my information from the American College of Obstetrics and Gynecology. So what is informed consent? It is a process where a patient who is capable of making decisions authorizes or refuses a specific medical intervention or procedure after receiving, and these are the key words, adequate, accurate, and understandable information. When we talk about adequate information, we tend to refer to the diagnosis, what it is, or the nature of the situation or illness. What is the proposed procedure or intervention? What are the risks and the benefits? What alternatives are there? And risks of benefits of those. And including in the alternatives, what happens if I refuse as a patient to agree to undergo a specific procedure or intervention. This should be free of coercion. The patient should be given the opportunity to ask questions so that she can make an intentional and voluntary decision. In order for this to have the highest ethical standard, the amount of information and how complex the information is should be tailored to the patient's desires and her ability to understand. In obstetrics specifically, some of these decisions are difficult to make, and time may be of the essence. And at the end of the day, nothing is going to be done to a patient without explaining what's going to happen or what is the proposal, without the patient agreeing to that. And it is important, especially since obstetrics, again, there may be decisions where time is of the essence, say an emergency cesarean section is needed or an emergency intervention because there are concerns for the mother or for the baby or for both. It is good practice maybe to inform yourselves, and a good way would be to ask questions during your prenatal care. What are your fears? Write them down. Most obstetricians, gynecologists, most healthcare providers, they actually like when patients write questions down because they're usually questions that are well thought out and that will ease some of the uncertainty. And maybe talk about anticipatory situations, fears that you may have, so that ideally you can make the most of your prenatal visits or your doctor's visit. And again, most well-informed patients tend to make better decisions, be sure about their decisions when the time comes, get better outcomes, and be less anxious about the whole process. At the end, you have the power, you have some control over things. You can't control everything, but you can control how prepared you are and understand and have some acceptance to the choices that are made during your care as a patient. If you have any questions, again, this is a very broad topic. Please feel free to leave a comment. or a question, and I'll do my best to answer them at least once a week. And then I'm planning on posting more videos every week, and I'm planning to share them on Facebook and on Instagram if I can. I'm still trying to figure all this out. I hope you're all well. Take care of yourself and enjoy your pregnancies.